a urologist and prostate health specialist, and today we're going to have an important conversation about prostate wellness that every man over 60 should hear. Prostate health often goes overlooked, yet it plays a crucial role in urinary function, sexual health, and overall quality of life. Many men over 60 follow standard dietary advice, believing that certain foods are beneficial for their bodies and their prostates. Yet some of these so-called healthy foods may contribute to subtle changes in prostate tissue that can lead to enlargement, inflammation, and urinary symptoms. Understanding how your diet interacts with your prostate is one of the most effective ways to support long-term prostate wellness. Over the course of my 25 years of clinical practice, I've seen firsthand how small dietary adjustments can improve prostate function, reduce urinary frequency, and positively affect PSA levels, giving men not just relief, but renewed confidence in their daily lives. Today I want to talk about 3 commonly consumed foods that, while often considered healthy, may influence prostate function in ways many men do not realize. And I will also discuss practical alternatives that promote prostate wellness, while still providing essential nutrients for aging men. The challenge: understanding dietary impacts on the prostate. As men age, changes in hormone levels, inflammation, and tissue growth can contribute to prostate enlargement, known as benign prostatic hyperplasia. The symptoms can include waking multiple times at night to urinate, a weaker urinary stream, a sense of incomplete bladder emptying, and changes in PSA levels. Many men experience these symptoms while following dietary recommendations intended for overall health, such as increasing protein intake, consuming dairy for calcium, or using plant-based oils instead of saturated fats. The challenge lies in recognizing that some foods, although beneficial in certain contexts, may have compounds that subtly affect prostate tissue. In my practice, I frequently see men who are surprised to learn that small, consistent dietary choices can influence their urinary function and prostate wellness over time. The good news is that identifying these foods and making thoughtful substitutions can help support prostate health, reduce inflammation, and enhance quality of life without resorting to medications or invasive procedures. Food 1. Soy and phytoestrogens. Let's begin with soy products. Soy is widely promoted for heart health and general wellness, and it contains plant compounds called phytoestrogens, which are naturally occurring molecules that can mimic the effects of estrogen in the body. For many men, moderate soy intake is fine, but research suggests that men over 60 may want to monitor their intake. Aging men experience changes in testosterone and estrogen balance, and consuming high amounts of phytoestrogens may influence prostate tissue in subtle ways. Soy products include tofu, soy milk, edamame, and protein supplements. And while these foods can be part of a balanced diet, it's important to consider moderation and diversify protein sources to avoid any potential impact on prostate tissue. In practice, I've seen men adjust their soy intake while ensuring adequate protein from alternative sources, leading to improvements in urinary comfort and overall well-being. The takeaway is not that soy must be eliminated entirely, but that mindful consumption and pairing with other protein sources like fish, lean meats, or plant proteins such as hemp, pea, or rice can create a more balanced dietary approach for prostate support. Food 2. Dairy and growth factors. Next, let's talk about dairy. Milk, cheese, yogurt, and other dairy products are excellent sources of calcium and protein, which are important for bone health and muscle maintenance. However, dairy also contains naturally occurring growth factors, such as insulin-like growth factor 1, IGF-1, which help promote cell growth in the body. While this is beneficial for children and younger adults, older men may consider moderation to maintain prostate health. Excessive dairy intake can sometimes correlate with subtle increases in prostate tissue activity and inflammation in susceptible individuals. Additionally, high calcium intake from multiple daily servings can influence vitamin D metabolism, which is important for regulating cell growth. To maintain bone health while supporting prostate wellness, I often recommend diversifying calcium sources with leafy greens, sardines with bones, fortified non-dairy milks, or targeted supplementation. These alternatives provide essential nutrients without relying solely on dairy products, allowing men to support both skeletal and prostate health. Food 3. Vegetable oils and omega-6 fatty acids. Finally, let's discuss vegetable oils rich in omega-6 fatty acids, which include corn oil, soybean oil, sunflower oil, and safflower oil. These oils are commonly recommended as heart-healthy alternatives to saturated fats and are widely used in cooking and processed foods. Omega-6 fatty acids are essential, but modern diets often contain far more omega-6 than omega-3, creating an imbalance that can promote inflammation throughout the body. Prostate tissue, in particular, is responsive to inflammatory signals, and a diet disproportionately high in omega-6 may contribute to subtle tissue changes that affect urinary function. To optimize dietary fat for prostate wellness, I suggest using oils lower in omega-6, such as olive oil, avocado oil, or coconut oil, and increasing omega-3 intake through fatty fish like salmon, mackerel, sardines, or high-quality fish oil supplements. Balancing omega fatty acids supports systemic anti-inflammatory effects, cardiovascular health, and prostate function, helping men maintain comfort and urinary ease. Recognizing early signs of dietary impact on the prostate. Understanding how your diet may influence prostate health begins with paying attention to subtle signals from your body. Men over 60 often experience gradual changes in urinary habits, and these can serve as early indicators of prostate stress or enlargement. For example, an increase in nighttime urination, waking more frequently to use the bathroom compared to previous months, can be one of the earliest signs that your prostate may be reacting to dietary or lifestyle factors. Similarly, noticing that your urinary stream is weaker than it used to be, or that starting urination requires more effort, may suggest that the prostate is slightly enlarged or inflamed. Another common signal is the feeling of incomplete bladder emptying, which can leave men frustrated and fatigued after repeated trips to the bathroom at night. Changes in PSA levels over time may also provide insight, as PSA reflects activity within prostate tissue. Importantly, these early signals do not automatically indicate disease or serious pathology. Instead, they offer an opportunity to proactively support prostate function through dietary and lifestyle choices. Men who make targeted adjustments, such as moderating intake of certain proteins, evaluating calcium sources, or balancing dietary fats, often notice improvements in urinary frequency, stream strength, and even energy levels. For example, reducing high phytoestrogen foods or moderating dairy intake can help create a hormonal and cellular environment that supports healthy prostate function. Working closely with a healthcare professional allows men to track these changes safely, interpret the results correctly, and feel confident that their dietary choices are positively influencing long-term prostate wellness. Practical dietary substitutions for prostate wellness. Once the early signs suggest that dietary adjustments could be beneficial, implementing practical substitutions is an effective way to support prostate health while continuing to meet overall nutritional needs. For protein, it's useful to diversify sources rather than relying heavily on soy or other singular protein types. Including wild-caught fish provides essential omega-3 fatty acids and high-quality protein, while grass-fed beef and pasture-raised poultry deliver nutrients without the compounds that may subtly influence prostate tissue. Plant-based proteins, such as hemp, pea, or rice protein, are excellent options for men who prefer vegetarian or plant-forward diets and provide amino acids needed for muscle maintenance and overall health. These protein alternatives offer balance and variety, ensuring that men receive adequate nutrition without placing unnecessary stress on the prostate. When it comes to calcium and bone support, moderation and diversification are key. While dairy is commonly recommended for calcium, excessive daily consumption can impact vitamin D metabolism, which is important for supporting healthy tissue function. Substituting leafy greens like kale, collard greens, or bok choy provides calcium in a bioavailable form while offering additional antioxidants and phytonutrients that support overall health. Small fish with bones, such as sardines, are another excellent source of calcium, vitamin D, and omega-3 fatty acids. Fortified non-dairy milks, such as almond or oat milk, enriched with calcium and vitamin D, can round out a balanced intake, and targeted supplementation can provide additional support where needed. These approaches allow men to maintain bone health without over-relying on dairy products, supporting both skeletal and prostate wellness. Fat intake is another area where practical adjustments can make a significant difference. Modern diets often contain high levels of omega-6 fatty acids, found in vegetable oils like corn, soybean, sunflower, and safflower oils. While these fats are essential in moderation, excessive intake can contribute to systemic inflammation, which may subtly affect prostate tissue. Switching to olive oil, avocado oil, or coconut oil for cooking and salad dressings provides healthy fats that support cardiovascular health and reduce the risk of inflammatory processes. At the same time, increasing omega-3 intake through fatty fish or supplements helps create a more balanced omega-6 to omega-3 ratio, which is associated with reduced inflammation throughout the body, including in prostate tissue. These adjustments in dietary fat contribute not only to prostate wellness, but also to long-term cardiovascular health, cognitive function, and metabolic balance. Case. Example: dietary adjustments and prostate function. To illustrate the potential impact of dietary changes, let's consider a practical example from clinical experience. A 68-year-old man came to me reporting progressive urinary symptoms despite diligently following conventional nutritional advice. His daily routine included soy milk with breakfast, Greek yogurt as a snack, cheese with lunch, tofu stir-fries for dinner, and cooking with vegetable oils. While each of these foods has benefits for general health, consuming them consistently in high amounts appeared to correlate with subtle changes in prostate function over time. After working with a urologist to assess his overall health, he adjusted his diet by moderating soy intake, diversifying protein sources with fish and lean meats, reducing daily dairy consumption, and replacing omega-6 rich cooking oils with olive and avocado oils. Over the following months, he experienced noticeable improvements. Nighttime urination decreased, urinary flow strengthened, and his overall sense of urinary comfort improved. While individual results vary, this example demonstrates that targeted dietary adjustments can complement medical monitoring and proactive urological care, offering meaningful benefits for men seeking to maintain prostate function and quality of life. This case emphasizes the importance of a personalized approach, taking into account both nutritional needs and the subtle signals that the body provides. Supporting prostate health during dietary transition. Making changes to long-established dietary habits can be challenging, and it's important to support prostate function during the transition. Certain nutrients and plant compounds can complement dietary adjustments by promoting healthy circulation, supporting anti-inflammatory processes, and maintaining hormonal balance. For example, natural sources such as watermelon extract, which contains citrulline, may help improve circulation and tissue wellness, supporting the prostate during the adjustment period. Additional botanicals, including nettle root and fenugreek, have been associated with supporting urinary comfort and healthy prostate function. Compounds, such as icariin, found in certain plant extracts, may provide gentle support for circulation and tissue health. These options are not intended to replace conventional medical care, but can serve as complementary strategies for men who want to optimize their prostate health during dietary transition. Incorporating these nutrients alongside balanced protein, calcium, and fat intake can create a comprehensive approach that supports both comfort and long-term wellness. Tracking progress and measuring outcomes. Monitoring progress during dietary changes is a key step in ensuring that adjustments are effective and safe. Keeping track of urinary frequency, stream strength, sensation of bladder emptying, and PSA levels provides measurable feedback on the impact of dietary modifications. Tools, such as the International Prostate Symptom Score, IPSS, offer a validated method for quantifying daily urinary function, allowing men to see tangible improvements over time. Regular follow-ups with a urologist provide additional support, guidance, and reassurance, enabling adjustments to diet or lifestyle as needed. This proactive approach empowers men to take an active role in maintaining prostate health, while providing the confidence that their choices are positively influencing long-term outcomes. Tracking progress also helps men recognize early improvements, reinforcing motivation to maintain healthy dietary patterns and lifestyle behaviors that support prostate function, urinary comfort, and overall wellness. Conclusion: proactive steps for lifelong prostate health. Maintaining prostate health is not simply about following generic dietary recommendations or waiting until symptoms appear. It's about understanding how specific foods, nutrients, and lifestyle factors interact with prostate tissue and taking proactive steps to support comfort, function, and long-term wellness. Moderating soy intake, diversifying protein sources, reducing excessive dairy, choosing anti-inflammatory fats, and incorporating prostate-supportive nutrients all contribute to maintaining prostate health while supporting overall well-being. These choices can help men over 60 experience improved urinary comfort, better sleep, and enhanced quality of life. Beyond nutrition, regular monitoring, awareness of early warning signs, and partnership with a urologist are essential for achieving sustainable results. By taking thoughtful, evidence-informed steps, men can reduce inflammation, support healthy hormonal balance, and enhance prostate function, creating a foundation for lifelong urological health. Dietary choices, when guided by knowledge and clinical experience, are not just about nutrition. They are a tool for maintaining autonomy, comfort, and vitality as men age. A personalized approach that balances nutrition, lifestyle, and medical monitoring empowers men to maintain prostate wellness, enjoy a high quality of life, and feel confident in their health journey for years to come. Proactive, informed steps taken today can provide measurable improvements, creating lasting benefits for urinary function, hormonal balance, and overall vitality, helping men feel more confident, comfortable, and empowered in every aspect of life.